Good morning. Let's talk about realistic health goals in 2026. And I have notes, so you're going to see me look at them. And this is information that I have collected for a lifetime. This is information that I've known from the bedside. This is the information that I've known from working in the healthcare field. I used to write letters to insurance companies for them to pay the hospital bills for the clients that have paid them hundreds and thousands of dollars. Also, for them to be told no, that they won't pay it. So I'm going to break this down to you like this. For one, are you healthy? Are you sick? Do you have anyone who's talking to you about preventative measures? Like, let's say you have heart disease. Is there someone who's talking to you about a healthier eating style? Is there someone who's actually trying to get you managed off of your blood pressure medicine because you're eating right, you're exercising, and you're doing the right thing? Now, I will tell you, there is some information that I do want to share with you about services that I offer, but you know what? This information right here, take it. Take it. It's free. It's free for you to know because I want you to know the truth. And I've also been told, and I've also been called a truth-telling CEO. I own and I have founded Self-Care CEO, Self-Care University OK. I was getting ready to say Self-Care CEO. That's my podcast. So, Self-Care University OK. I have had it for 27 years. It's my business. I've been doing naturopathy practices for 27 years. You name it, I've talked to, I've worked with some of the best cardiac surgeons and providers. I've worked with the best oncologists. I have worked with the best gastroenterologists. I have been around the globe with learning, especially at the bedside, and doing my own research. And I just want to hand this off to you. Okay, so you're going to see me looking at it, and I would like to call this, we're going to talk about realistic 2026 insurance cost ranges. We're going to be talking about comparisons between self-pay and proactive wellness. We're going to be talking about the actual annual cost comparisons to the programs that I offer. If you offer programs, yay for you. And you know what? I really hope that you offer something like this to your clients as well. The reason why I do what I do is because I see no one else doing it and I see a need. So I see no one else doing it, which still has this need, but no one decides to do it until they see someone else pulling up the bootstraps and helping clients and patients, and then they all of a sudden decide that they want to, oh my gosh, I want to incorporate that in my business. You should have been doing that all along, okay? So, now, this is what health insurance is projected to be in 2026, okay? Now, these are conservative, realistic projections based on the current trends. And I'm just going to tell you, I have been watching President Trump. I've been watching what they have talked about. I've been watching what the Senate in the Congress have been talking about, and health insurance is projected to go up. So just be mindful. You can't really know anything in 2026 unless you've actually completed out the year 2025. And that's a good statistician would tell you that. So, all right. So monthly premiums are about $500 to $750. And I just want to tell you, if your job is telling you that your health insurance is included in your pay, they are making money off of you, allegedly. Now, and you may think, oh my gosh, well, it's okay. I don't need health insurance because my job already provides it. Look, I've taken many trips around the sun. I've done plenty of education. And to me, you should know the truth. Okay. Your check that you're getting, just remember, if you own a business, just know, yeah, you get a little something whenever you pay for your employees' health benefits. So it's not out of the kindness of their heart. It does sound like it though. It's kind of nice, but it really does come out of your check. But they still get a little something on the side, allegedly. All right. Just remember, I am not a healthcare insurance expert. I am not a lawyer, and we'll just go with that. I'm just giving you this information out of the kindness of my heart. So your annual premiums would be around 6 to 9 grand. Okay? You multiply that by 10. For 10 years, if you are paying about 9 grand, okay, that's $90,000. That's not even in your lifetime. That's just $90,000 in 10 years. Did you need the health insurance? Did you use it? What could you have done with that money? All right. Deductibles. Those are adorable, by the way, and they absolutely make me want to puke. Okay? So you pay $6,000 to $9,000 a year. This is for 2026 projections. If you're living in this right now, then this is going to make a ton of sense. Now, deductible, $5 grand to $9,000. And also, if you have your insurance who pays for your insurance, you likely have a severely high deductible. Okay? Now, so $5 grand to $10,000. That's really before the insurance starts actually helping you. Does that money not sound like the amount that you're paying? I'm not a mathematician or anything, but I've done math before in my life. But I'm just saying, if my annual premiums and my deductibles, the kind of the same amount, doesn't it kind of almost seem like I'm giving money to somebody? Yeah. One of the things that you should know, that if the max out of pocket would probably be around $8,000 to $10,000. So if you're doing the math and you have health insurance, if you are healthy, did you know that many healthy people pay $6,000 to $9,000? I was going to say 10 grand, but I'm just going to stay on the generous side. Remember, I said this is conservative math, okay? $6,000 to $9,000 and don't even use their insurance. And did you know that these same people that are healthy still pay cash for their supplements? We've all seen TikTok. We've all seen those celebrities that are trying to bust out all their supplements and their proteins and all the things that they think that they have created, this castor oil and that sea moss and this collagen. Really, if you want to get down to business, if you're wanting to stay healthy, there are less expensive ways than $9,000. Did you know that people will pay out of pocket for labs? Did you know that there are lab works that insurance does not pay for? Also, if you do have insurance, have you seen yourself having the bill where it said $600 and then you owe $124? Did you know that if you did self-pay, allegedly, it could be less than $124 that you paid for the lab work? So, nutrition. If you have a registered dietitian, they are able to take health insurance. Yay for them. If you have a physical therapist, yay for them. They are allowed to take insurance. Did you know that a registered nurse is not allowed to take health insurance? But yet we're the one pumping out the education. I am, at least, because I want you to know it. Okay? So, what about wellness? Anything wellness that you're trying to do, like today I have a Eat for Your Hormone type webinar. It's $27. That's wellness. If I had an HSA card or an FSA card, I would all day long ask for a letter from me for a letter of medical necessity. And I would say, hey, this information was so valuable. I would love to turn this in as an opportunity for my insurance company, because you have to have insurance to have an FSA or an HSA for them to know that I'm trying to take care of myself. And then you get your $27 back, probably. More than likely. My gosh, why would they say no? All right. So what if a healthy person redirected that money? Okay. So let's say someone that is healthy in 2026 and they spend $7,200 yearly for insurance premiums. Okay. So that's about $600 a month. If you're doing math, that's $138 a week. And if they don't need to use insurance that year, the money's gone. They bought their yacht. They bought their whatever, their new building, their new high rise, their new home in San Francisco by the Bay. Okay? All right. So now let's compare it to intentional self-care wellness. So this isn't just to bash insurance companies, but let the chips fall where they may. Because what I say is literally a projection for 2026. Okay? So, but be mindful that if you had $9,000 right now in December because you saved all that money and you didn't need it and it was sitting in your savings account, could you have taken your family on a vacation? Could you and your bride or you and your groom gone somewhere super fancy for dinner like Mahogany Steakhouse, the Ranch Steakhouse where all the rich people go? You literally are more wealthy than you think when you are healthy. So when you're on the health mindset, I know that there are millions of great intentions, expectations that are set in a new year. That's why gym membership is the highest, and it is literally enough for a gym to survive on for the rest of the year, because there are many people who sign up for a gym. And then, you know what? It's around April or May. It's true. It's a real day. It is where people actually fall off the wagon and stop going to the gym, but yet they still pump out the fee because they paid for a 1-year membership, or they paid for them to be on a billing cycle. Okay. But just remember, how many times did you go to the gym this year, and was it worth it? Or did you just pay for the electric bill for the gym facility and for them to buy all that brand new equipment to facilitate more people who are going to be paying to go to the gym and not go? All right. So you're going to hear me talk about 2 programs that I offer, and I hope that this is plenty as an opportunity for you to lend an ear to what I'm saying. Okay? Because the information that I gave you in the very beginning, that is for you to put away in your purse, to put away in your wallet, and just give it a good think. Okay? And if you are just now tuning in, I would absolutely make sure that you go back and watch the beginning of this video. It's perfect. Okay? It's perfect for you. So I have a women's wellness journey. I have offered that membership for so long, and it is very, very valuable. Okay? And I'll tell you what you get inside. Okay? All right. So $67 a month is how much it costs to be inside the women's wellness journey. You do get a significant discount when you pay for a year. You get a significant discount when you pay for a year, or you can actually just try it out each month and see how you like it, just like you would your gym membership. Okay? And that's $804 a year if you paid $67 for 12 months. Now, remember I said you get a significant discount when you pay for the entire year. Okay. Now, the year starts whatever, let's say you start in February, then it's to the next February. Okay? Or if it's May, then it's to the next May. All right? Now, it is RN facilitated. It is facilitated by me, and I'm going to tell you, I have a wealth of referrals of top-notch providers that are natural, that provide natural ways of healing, and you would save yourself thousands, hundreds, and thousands of dollars if you're someone who says, I don't know, do I want to try a year without paying health insurance? You do you, okay? All right. So also you get education, you get hormone support, you get to ask Q&As, 24/7 access to ask all the questions that you want inside that program. Some would say that it is like whenever you have access to a provider monthly, it has actually saved them so much heartache, and it's actually prevented them from overspending on products that they absolutely did not need or were guided. I'm talking about me, we're guided into something that's super consolidated, and you don't have to be on it for very long, and then just go along your day. It's not anything that 3 years later you're finding yourself still on it, paying money to big pharma. Anyway, all right. supplement reviews, guidance, that right there. I will tell you, I have saved so many people so much money with that, and I would call myself a supplements guru. Well, that's not even self-appointed title. There people are like, you know so much, and I do, because I do my research. I've been doing my research, like I said, for 27 years, and it is prevention-focused care. So that still leaves another $6,400 plus in your pocket compared to what your insurance premiums alone were. Now, remember, when you pay insurance, right, you're paying them the $6,000 to $9,000, okay? You're paying them that money, and you don't get it back. At the end of the year, whenever you said, ha, ta-da, I didn't have to go to the hospital, I didn't have to go to the ER, and I went to my wellness visits for my doctor, they never give you a credit, and if they do, it would probably be maybe a couple of $100, but what is that? That's like handing you a penny, okay? So, what is nice about saving $6,400, what do you want to do with that? Do you want to invest that into stocks? Do you want to invest that into your kid's school? What do you want to do with $600 or $6,400? Okay. Now, I also have another program. It is Wellness, Weight Loss, and Gut Detox Program. Oh my gosh, this is really nice. So in this program, it is $67 a month, $804 a year. Are we seeing a theme here? Right. Which one do you want? Do you want women's wellness? Do you want to talk about your hormones? Do you want to talk about all the things that go with women's wellness, right? And then over here, you may have someone who's like, oh my gosh, I need to know how to eat for my body type. Just so you know, that is a program that I've offered for 27 years. Eating for your body type is what I call it. So it is a program that I have been through many a cardiologist, many a gastroenterologist, many if you have type 1, type 2 diabetes. I'm not saying I'm a registered dietitian. I never said that. I'm a registered nurse with a bachelor's degree and over 8 certifications. Your girl has stayed very much in the know of being certified to provide the knowledge that I give you. My clients, really. So, inside that program, they get supplement. That supplement information is really, really great. All right, but it's based on your individual needs. So let me just tell you this: the Women's Wellness Journey and the Wellness, Weight Loss, and Gut Detox Program. Okay, well, so it's a group program, just like you would join your gym. Your gym is not held liable for your six-pack. Your gym is not held liable if you gained 30 pounds, okay? Because it's what you put into it. It's what you ask. It's what you want from it, okay? So when I'm telling you that either one of these programs, they are tailored to you, even though they are group programs. And no, not everybody sees everything that you and I are having a discussion about. HIPAA is still compliant in this. It's wonderful. These programs are great. Now, got your hormones, got your women's wellness. I see so much chatter on social media. You name it, I've seen it. Whether it's YouTube, TikTok, Facebook, wherever. I have seen so much horrible advice given, and I'm like, I can't. With my license, I cannot give medical information on social media. I cannot. Because for one, you didn't sign a consent. You did not sign a consent for me to treat you. Now, in these programs, absolutely, game on. You've got a question, you private message me, we have a conversation. There you go. Nobody has to know about it. In the group, you all can ask all kinds of questions. It's phenomenal. Now, let's go back over to the Wellness, Weight Loss, and Gut Detox Program. This is where you learn eating for your body type. Now, I know today's webinar is eating for your hormone type. Really? Could we have a phenomenal conversation? Yes, we can. In either one of these, okay? But eating for your hormone type is so specific. Why do you keep the 20 pounds on? Why do you keep that 20 pounds on and you can't even get rid of it, and it's May and you're trying to get into that suit that, because you want to go to Cancun or whatever, and you're like, I'm still carrying the weight around from the holidays. We talk about that today. Now, inside the Wellness Way Gut Detox program, we talk about supplements that are right for you if you want. I talk about natural GLP-1s, and y'all, I will tell you, if you are on a synthetic GLP-1, you do your thing, Jelly Bean. But I will provide to you, if you want, a suggested dosing pattern. A suggested dosing pattern. I'm not saying I'm ordering it. I'm saying a suggested dosing pattern, because you will find that going to the highest is not always best. Okay? Any practitioner who prescribes you a synthetic GLP-1 should already know that. Okay? I know natural GLP-1s. I've done that education for years. Okay? I already know the natural ones. I already know the ones that are phenomenal, wonderful, great. But remember, like the gym, you got to put in the effort. All right. So there we go. You get food. You get access to 30 days of meals that are for whatever religion you have, whatever health journey you're on. If you want to do carnivore, but just remember, there is eating for your hormone type. Is carnivore best? What is Mediterranean best? Should you fast? Should you not fast? Okay? This is education, and it's super, super wonderful. And also, it's designed for you to stay healthy. I mean, oh my gosh, that is what a great concept, right? I hope so. And still, there are people who save thousands and thousands of dollars. Okay? And that's way less than your insurance premium. And natural medicine, natural supplements, natural way of living, using food as medicine. I don't think that should be lost on any provider that you have. Okay? I hope that if you do not choose any of my programs, I hope that you reach out to your provider, and I hope that they help you out with that. And I would love for you to be a part of the Eating for Your Hormone Type webinar tonight. It is at 6:30. I have shared it many times on here, but I would be more than happy if you if you direct message me, you hit the little profile thing on there, and you say, I would love the information for tonight's webinar. You bet, I will give it to you. Just know that if you watch the replay, it's $10 more than tonight's. I'm telling you, get in, because you are going to get access to a really wonderful special surprise. Really wonderful special surprise. And I don't say anything like that lightly. And I just think, you know what? Anytime I go to the store and something says 10% off, I'm like, oh, nice. But if something says 15% off, I'm like, which you probably would never see. 20% is like, okay, now you're teasing me. But I'm going to be offering something that is 25%. So all I got to say is, when you show up for yourself, you show up for your health. It really does show. I hope this information that I provided to you really does resonate. I hope it brings you to the point of where you would love to book a call with me, and let's have a conversation. SelfcareUniversityOK.com is my website. You can scroll all the way to the bottom where it says Q&A, and you're welcome to book a complimentary 20-minute chat with me, even if you are a healthcare provider. Yes, if you are a healthcare provider, I work B2B, and if you are wanting something like this for your clients, I would be more than happy to talk to you about the special pricing that I have when I work with practitioners, because I appreciate the referral. Well, that is it. That is my little bitty nugget of wisdom that I wanted to share with you all today. It's on my mind, and I am happy to help. You just have to ask.